Hi, this is Dr. Richard Dutton from the Anesthesia Quality Institute with a few words about easing patient anxiety when they're presenting for anesthesia. We expect our patients to be anxious when we're coming for surgery. This is a normal human emotion, particularly when taking a voyage into the unknown, which is what anesthesia is for most of our patients. There's a loss of control associated with anesthesia that bothers people. There's fear of the unknown, and somewhere lurking in the back of their minds, there's concern that they'll have pain, that they'll be sick to their stomach or feel lousy, and even that there may be safety issues, that they could be hurt or die. Addressing anxiety in patients is one of the best ways to produce better patient satisfaction and to provide the patient with a better experience in your hospital or operating room. The ways we diminish anxiety in patients are first to acknowledge it. So as I'm talking to a patient initially, I will start the conversation, generally with something social. Hey, how about them Cubs? Or something like that, just to break the ice, get talking to them. I will introduce myself. I am Dr. Dutton. I'm going to be your anesthesiologist today. I ask them how they like to be addressed. Do they prefer Mr. Mrs.? Do they like a first name or have a nickname they want me to address them with? And that can be an important age-based difference in patients. Once we get the conversation started, I acknowledge that they're probably nervous about the procedure. I actually tell them I'd be more worried about them if they weren't nervous. I want to get across the idea that that's a normal human reaction to having surgery or anesthesia. Then we'll get down to business. And how quickly we do that depends on the patient, depends on their level of anxiety. So when I'm doing my preoperative assessment, I will explain to the patient everything that's going to happen, sort of step by step. This increases their sense of control and will reduce their anxiety. A couple other things the anesthesiologist can do to reduce patient anxiety. You want to keep waiting time short. Waiting builds anxiety in the patient, especially if they don't know what's going to happen, they don't know why there's a delay, and they're waiting. So some of that is just logistics for the operating room as a whole. You want to bring the patient at the right time, you want to move them through the procedure smartly. If you are in a place like most of us are, where there are going to be some delays, waiting in the pre-op holding area, for example, you want to tell the patient about that up front, say, oh, it's going to take us a few minutes to clean up the operating room and get ready for you, or to gather all the people we need to help you. So just be patient with us. And I try and do that up front so they know there's going to be a delay. If I think the patient's going to get it, I will often make a little joke there. And sometimes I'll look at my watch and say, we'll be rolling to the operating room in exactly 37 minutes. And it gets them focused on me and that time and not thinking about the scary parts of the day. And then we joke about it. You know, if we're 10 minutes faster or 10 minutes slower than that, I'll acknowledge that as we're rolling back toward the operating room. Oh, see, we got here 5 minutes faster than I said. You should give us credit for that. Whatever. But again, it helps take the patient's mind off where we're going. As I talk to the patient as we are rolling back to the operating room, that's a good time for a social conversation. And the affect I'm trying to project at that moment is this is just another day at the office. So I'll ask them where they came in from. I'll chat with my resident or the operating room nurse about, hey, what are you doing tonight? Or did you see the game last night? I want the patient to think that this is routine, that they're going to be fine because we do this every day. That's part of what I'm trying to project. At the same time, we want to project that it is all about the patient. So we want to stay very focused on them. So I want to move as quickly as I can from coming in the door of the operating room when anxiety will really tend to spike up until they're asleep. I want to make that happen as quickly as we possibly can. So we're going to stay very focused on the patient at that time. We've set everything up in advance so we can move through that part quickly and smoothly. And we want to be fast but not rushed. And the aura we want to project is it's all about the patient. We're focused on them. We're talking to them. We're looking at them. But it's just another day at the office. And that's an interesting thing that you have to try and get across. But it will greatly relieve patient anxiety if you can do that. And then the final thing, just a few little tips in the operating room that most anesthesiologists already know. We try not to crucify patients, so don't put their arms out while they're awake. Keep them tucked to the side. Give them the warm blanket. They really like that. Let them position themselves on the bed and get their head at the right level so they're comfortable. Some people like a blanket under their head, some less so. Keep them warm, keep them wrapped up. Chat with them again, continue to talk to them. I try not to ask them questions though. I don't ask, are you all right? Are you warm enough? Does this hurt? Because it raises the question in their mind, oh, is this supposed to hurt? And it will increase their anxiety. But I talk to them. I say, this may burn a little. We're going to give you that mask now. This is the circulating nurse. All declarative sentences that they can focus on. They think about listening to me rather than becoming more anxious about their operation. We are careful in the language we use when the patient's listening to us, so you don't want to use the word paralysis. We use relaxation if that's necessary. So if the surgeon asks me a question about that, that's how I'll answer it. We don't use the phrase put to sleep, because when this patient was 10 years old, they had a dog named Rover, and Rover was put to sleep and never came back. And that's stuck somewhere in the back of their heads. So I don't use that term. We'll say, you're going to go to sleep now. You may drift off. And then the last thing I say to the patient, usually as I'm pushing the induction medications, is something like, you're going to go to sleep now. We'll be right here with you. We'll take good care of you. We'll see you when you wake up. And those are usually the things I try and fix in their head as they're going to sleep. All of these little things will help reduce anxiety in the patient. And if you think about them as a physician, think about the experience from the patient's point of view. You'll find your own things in your own setting that will really help you do this. And you'll find that your patient anxiety goes down and your patient satisfaction goes up. Thank you.